welcome back. So for this video, I think it's gonna be a long one because it will be based on 3 books: Approaches, Redefining Music Therapy, and Improvisation for Groups. So I guess you're in for a ride. So without further ado, let's start. For approaches, it will be divided into 3 sections. As for the section 1, it will be focusing on approaches adapted from music education, which are Orff, Delcroix, and Kadai. To start with Orff approach, so it is based on Carl Orff's Schulwerk model, which means to experience first and then intellectualize. So basically it's sound to symbol. The 2 basic premises that everyone can participate and music in the classroom should be elemental, meaning we integrate elements of speech, dance, of movement in its natural state in a way. Rhythm is considered the foundation in elemental music. In speech, so when you're developing the melody, you can do it through call and response, chanting, pentatonic modes and diatonic modes, metered versus unmetered speech. And then as for movement, so there are 3 areas. You can do rhythmic, free or interpretative, and accompaniment movement. To model accompaniment patterns, they usually do movement or through movement. And then as for activities, playing instruments, speech, singing, and movement are natural, accessible, and learned best through play. So they also use ISO principles, so you should start where the client is and focus on what they can do. In here, the approach is more on the process and functional outcome. And it is success-oriented intervention, not on the product, but more on the process. And then the use of culturally specific material is highlighted here. And then they also use barred instruments such as xylophones, metallophones, contrabass bars, glockenspiel. He also made some instruments specific for this approach. In this approach, we have 4 areas of musical development. So they do it through exploration, imitation, improvisation, and creation. So exploration, basically they explore through sound and movement, and then process of imitation, so either can be through speech, body percussion, movement, singing, and all that. And then improvisation is basically imitation plus adding new patterns. And then of course creation, which is a combination of all 3, and then gradually introduce to their written form or music or in text. Then 3 steps in process in music therapy. They should have the experience within structure, in self-organization, and in relating to others. As for the therapist, it should provide or target client opportunities for self-motivation and personal choice, opportunities for self-organization and self-expression, opportunities for communication. It targets communication, motor, cognitive, psychological, perception of self, reality awareness, emotional, vision, hearing, and music. Next is Delcroix's approach to music therapy, basically eurythmics. It is developed by Émile Jacques Delcroix. So he believed that rhythm and music should be felt in the body. So physical movement strengthens inner hearing, coordination, and musical understanding. So he developed 3 facets. First is the eurythmics, so we do it with purposeful movement. Second is solfège rythmique, meaning through inner hearing. And then improvisation, where they could transfer learning from movement improvisation through instrumental and vocal improvisation. Should be noted that all are interdependent, so all goes hand in hand. And then in this approach, they have a culmination, which is called the plastique eneme or plastique. And then, of course, it is active learning because they are physically moving. As for the steps or procedures, so to start with games, activities, they can walk, move, run, sway in response to rhythm, tempo, and phrasing. So basically to physicalize music. So exercises in improvisation can be vocal or instrumental, and then solfège and ear training are incorporated to strengthen pitch and rhythm and perception. Common goal would be for expression and motor rehabilitation. Lastly, the Kadai approach. So it is developed by Zoltan Kadai. So in here, singing is the foundation of music learning. Comparison with the lacrosse, more on rhythm, and then comparison with orf, so they integrates different aspects or activities and also uses instruments. In Kadai, singing is the foundation. So they have 4 key elements: singing, especially folk music, then solfege and movable do. Then folk songs, so it represents an identity, and culturally relevant music connect learners to heritage. And then sequential development, so it all starts from simple to complex following child development. As for the elements, so it begin with singing familiar folk songs, and it's primarily taught best in a cappella, and then movable do, solfege, and hand signs to reinforce speech. And then adding the pentatonic mode, and then the major, and then the minor. And then they apply rhythm syllables like ta, tt for temporal awareness. So for quarter note it's ta, 8th note is tt, 16th note is tiri tiri, and then half note is ta, then dotted half note ta, then whole note ta. And then progresses gradually to reading and notating music. In Kadai approach, there are 4 stages. So first is the preparation or prepare. So it prepares the child for the new materials. It can be through rote singing, singing loudly or softly, clopping the rhythm, stepping the beat, and playing singing games. And the next is to make conscious. So you can do it to showing through hand signs, rhythm, notation, and ask questions to promote discovery, and then try to reinforce it. So teacher reverts to techniques from the first stage and then expose children to more music to practice the new element or concept, and then lastly is to assess. Allow to read new songs with melodic and rhythmic elements to see if they internalize and to help them remember and of course apply it, and then all stages are repeated for each new rhythm. As for measuring progress from elementary to secondary level, it can be measured through frequency and length of music lessons, previous musical experiences of the children, and comfort level and competence of the teacher using Kadai techniques. In contribution to music therapy, so music therapists can apply aspects of the Kadai approach to work with clients with special needs, as this approach makes music literacy accessible to all children, regardless of disability. And then Kadai's approach is based on multisensory experiences, and it is also based on task analysis and successive approximation, so each child has a chance to succeed. And then the music therapist can start where the client is and build upon the client's abilities. And of course, in this approach, it emphasizes learning music from one's own culture, allowing for music therapists to better engage clients by using culturally appropriate music. Now for section 2, psychotherapeutic approaches. So there are 4: BMGIM, so bonding method of guided imagery music, Nordorf-Robbins or creative music therapy, psychodynamic approach, and behavioral approach. Bonding method of guided imagery and music. So it is developed by Helen Bonney. So in this approach, music is a gateway to the unconscious, evoking imagery that facilitates healing, insight, and transformation. So it combines music, psychology, and relaxation. So it is based on humanistic and transpersonal psychologies and also self-actualization from Maslow. And then listening programs containing emotional characteristics, comforting, positive, affect, then affect release, and then imagery. So Bonnie created that listening programs with each music related to that characteristic, and then the music, it should reflect on the current mood or the internal struggle, and then the mood of the music should be in between, so not too stimulating and not too stagnant in a way. And then cartoon images may represent an attempt to lessen the impact of the original image, maybe on a defensive maneuver. And then as for the therapist, they should have personality, good personality of course, training, and commitment. Now for the procedure or steps, so it starts with preliminary conversation to identify clients' the focus or their intent, history and major concerns, and to be oriented as well, and basically it sets tone to the entire session. And then second is induction. So in induction there is relaxation and concentration. So if they're not relaxed yet, so you can do a relaxation either through PMR or autogenic, and then the concentration begins. So it is a bridge to the music listening by describing an opening imagery scene. And then music listening. So music listening lasts at least 30 to 40 minutes. So they listen to pre-selected classical music while music therapist gives verbal encouragement. So there is no interpretation, but the client can orally report on the imagery. So in music listening, there are three stages: the prelude, bridge, and the heart of the session. So basically, prelude is the starting lang, and then the bridge is surely evident. So it is a transition to the heart of the session. So it is evident through falling, flying, or any type of fall introducing the heart of the session. And then lastly would be the post-session integration or the review. So they reflect verbally and may use drawing or writing and music improvisation and movement to express it. As for the goals, it's usually used to elicit memory and feelings, helps lengthen attention span, sustain mood and relieve tension, and provide structure and allow for self-understanding. Next is Nordhoff-Robbins. So it is developed by Paul Nordhoff and Clive Robbins. So they believe that every person has a music child, an inner musical self that can be reached through active improvisation. So usually there are two therapists using this approach, the one who improvises and the one who facilitates. It is different from clinical improvisation where it avoids expressing personal preferences and feelings, but personalized to the client's emotional state, functions, and needs. It is also based in humanistic psychology by Maslow, which they develop strengths and potentials rather than focusing on one's deficiencies. So, techniques for evoking verbal responses can do humming, whistling, singing, nonverbal syllables, and chanting word phrases. As for techniques for evoking instrumental responses, you can introduce tempo changes, isolating melodic and rhythmic motifs out of what they improvise, presenting short melodic motifs and phrases that ends with a rest or unresolved tone, or playing harmonic progressions that are unresolved. Common goals and objectives is to develop clients' potential and usually focuses on long-term growth. And in this one, they speaks that musical growth is equivalent to therapeutic growth, where there's expressive freedom and creativity, communicativeness, self-confidence, and independence. As for assessment and data collection, so usually they do not collect data focusing on specific target behaviors. Instead, each session is audio or video recorded, then reviewed by team members after the session, and then the music made is transcribed for repetition and possible development in its succeeding sessions, and perceptions of the situation are analyzed. Document is a narrative style with a time basis. So what they do is the indexing. So it is a form of peer supervision. So they look for significant musical or non-musical responses, changes, musical relationships, and teamwork, focusing on moment-to-moment changes. They also developed an assessment instrument called the 13 categories of response. So example is evaluation scales 1 and 2. They measure the client-therapist relationship within musical activity. So there's high growth if there's higher musical expression and creativity, communication, self-confidence, and independence. And then as for scale 3, it measures musical complexity, expressiveness, and interresponsiveness of instrumental and vocal music. And in the tempo dynamic schema, it focuses on the elements in the therapist's improvisation, analyzes them, and categorizes their effects. As for functions of music, it facilitates transition, transforms ritualistic motor behaviors into communicative gestures, increasing emotional self-awareness, and enhancing interpersonal relationships. For the procedure, the therapist improvises that matches, accompanies, and enhances the client's state from moment to moment. And the client responds either through instruments, voice, or movement, so there is a musical dialogue going on. Music adapts flexibly to promote emotional, social, and communicative growth. Next is psychodynamic approach from Freud and Jung. So it focuses on unconscious processes and symbolic meaning. So music serves as a projective medium, allowing clients to express hidden conflicts. Interchangeable terms of psychotherapy kay psychoanalytic psychotherapy, psychodynamic psychotherapy, insight-oriented psychotherapy, so these are just the same. Psychodynamic approaches uses vocal and instrumental improvisation, songwriting, patient-selected music, music imagery, and body method of guided imagery and music. As for music-related concepts, so serve as a form of free association by Freud, make unconscious and conscious, Freud, the receiving split off parts of the self of the other, and can receive projections by Klein, music as transitional object by Winnicott, as container or holding environment by Bayan, as mirror by Kohut, I don't know, transference, countertransference, and intersubjective responses by Freud, Stern, Stotterow, and Atwood. For Freudian theory concepts, so the concept of drive, behaviors are motivated by instinctual drives, could be aggressive and libidinal. Then the conflict theory, the id, ego, and superego. So id, dominated by pleasure principle, focusing on fulfilling basic needs. As for ego, more on the reality principle, taking consideration of the external world. And then superego, internalization of parents' moral standards. And then psychosexual stage theory. So it is a stage of development that are related to the parts of the body, the oral, anal, phallic, latency, and genital. And then there's what we call as fixation, when something is present to an excessive degree and you have not overcome that stage. And then free association, reporting all thoughts occurring during a therapy session. Unconscious humming of music, desire to listen to a specific song, free associative singing, improvisation and instrument. Now let's learn some terms. Resistance, so there's a refusal to engage in free association therapy, which is an impediment to the therapeutic process. And in repression, so there's an unconscious forgetting of anxiety-provoking content. And in defense mechanisms, so these are unconscious coping mechanisms employed to ward off anxiety-provoking content. And then neutrality, so it is considered necessary in Freudian psychology so that the attitude does not reflect the wants of the therapist, but reflects the patient's projections. And then transference, encouraged through neutrality, the patient projects on therapists from significant people in their past, and then the opposite would be the countertransference. The therapist's reaction to the patient is based on her own projections, and sometimes it can be used as a therapeutic tool. For object relations theory, so it is an extension of the Freudian theory. So the focus here is shifted away from drive and intrapsychic conflict, but more on interpersonal component. So concepts here are relational problems are the focus of this type of therapy. The internal objects, basically an internalized representation of the external objects, and objects refers to the people. And then deficiency theory, an arrest in development due to the initial caretaker's inability to meet the infant's psychological needs. And then holding on or containment, the therapist is able to withstand the patient's concern, thoughts, and feelings in the form of a loud anger or inconsolable grief without being destroyed. So this may be a new experience for the patient as well. And then as transitional object, something that can facilitate separation from a caretaker by substituting the soothing effect, so you can use the song or music in that way. Next is self-psychology, developed from the deprivation model. So what is it meant? So it is model which describes insufficient development because of limitations of self-object experiences with significant others in the early stages of life. So what are these self-object experiences? So mirroring self-objects, confirmation of childhood's characteristics, the idealized self-objects, so these are images of calmness and ability, and then alter ego self-objects, so these are self-sustaining and learning things, and then adversarial self-objects, so healthy assertiveness without fear or impairing the relationship. And then empathy is important here, so the therapist provides a self-object relationship required for the client, done through supportive and reflective mirroring and communication. Next is intersubjective theory. So it is the most recent extension of psychodynamic theory. So here, intersubjectivity within the analytic relationship is important. Neutrality or objectivity is not viewed as acceptable within this framework compared with others. And then the patient experience is co-determined by the therapist. And in analytical music therapy, so improvisational form of music therapy as a way of exploring the patient's unconscious through the use of musical and verbal expression. So it is born out of psychoanalysis, but kind of different. Important here is that shared experience and closeness and therapeutic relationship is highlighted. As for the training, so the student is required to receive services from this framework in order to learn about the approach from within. The student works with a partner under the supervision of a teacher and plays a therapist and client. So there's no role playing used because the students are instructed to work through real life issues. For psychodynamic music therapists, they must have advanced musical skills, improvisational skills, advanced academic level, personal experience in psychotherapy or in psychodynamic therapy. It is highly desirable. And then the concept of resistance and defenses, concept of verbally mediated insight, which is not universally accepted with psychodynamic music therapy, but there's an implicit recognition of the importance of increased awareness and an understanding. And then the concept of neutrality, which we discussed earlier. As for the procedures or the steps, so you can do free improvisation or songwriting as an expressive activity, and then the therapist explores the transference and relationship projections and the musical symbolism, and then insights are linked to past experiences and unconscious conflicts, and then they may process after, either through art, music, or verbally, and it should come from the client, of course. And then if you use music imagery, so try to find the focus, the intention, and then you can do 5 to 10 to 15 minutes duration of music experience, which may include verbal dialogue or drawing or writing during or after the music experience. Then for improvisation is used to physicalize a dream. It is recorded and discussed over several sessions. And then if you use BMGIM, it is supplemented by art and improvisational music, and then lyric analysis if they are unable to express musically. Next is behavioral approach. So it is rooted in operant in classical conditioning by Skinner and Pavlov, and then of course the behavioral model by Watson. So classical conditioning, basically there's a stimuli equivalent with a responses. So there's a learned behavior like katong bell, and then the dog will know that it's time to eat. And then operant conditioning, behavior changes based on the consequence or reward that follows. So there's a reward system in a way. Then reinforcement, so these are interventions intended to increase frequency of behavior. So it can be positive by giving something, negative, taking something away. And then punishment is the opposite of reinforcement. So it is intended to decrease the frequency of a behavior. So positive, giving something, and then negative, taking something away. And then extinction, it is an abrupt withdrawal of positive reinforcement that is maintaining an inappropriate behavior. So through ignoring, so it is an appropriate intervention for attention-seeking behavior. Then contingencies, so these are parts of the environment that influence the client into modifying his or her behavior in a positive direction. So you can do rewards. And then token economy, so these are tokens given for on-task behaviors that can be used to cash in for a reward. Next is stimulus control. For classical conditioning, the foundation of classical conditioning is the mediational stimulus response. So this is how they do before conditioning. So the neutral stimuli is paired with an unconditioned response. Next is flooding. So it is used to treat phobias and anxiety disorders by exposing individuals to their feared stimuli in a controlled environment. Systematic desensitization, so it's the same with flooding in treating phobias and anxiety disorders, however, it differs in how they do it. So it is a gradual exposure. To compare with flooding, is more intense. Next is imagery, so it refers to the mental representation of stimuli that can evoke responses similar to those produced by actual physical stimuli. For operant techniques, we have task analysis, so this is a delineation of a selected activity into sequential parts, and then prompt, basically a cue to increase probability of a desired response, and then errorless learning, so it is a procedure to establish accurate client response as rapidly as possible without the appearance of errors, and then chaining, process of two or more responses being joined together systematically one at a time. So it can be reverse chaining, so a whole phone number, trying to omit the last one to see if they remember, or omit the last two. Then successive approximation, so it is a behavioral element or a subset of behavior, each of which more and more closely resembles the specified terminal behavior. Another operant technique is shaping, so it is systematically reinforcing each successive approximation, and lastly modeling, demonstrating an action to be taught of the client. Then we have Premack principle, so it is the use of high occurrence stimuli to reinforce low occurrence behaviors. So for example, using a highly desirable activity as a word, like for example music. It is a highly desirable and effective Premack activity. And then generalized condition reinforced or reinforcer, so it's the one that provides access to other types of reinforcement that can be either primary or secondary. And then contracting, so it's the placement of a contingency for reinforcement into a written document. And lastly, group contingencies, so peer pressure can actually help, leading toward a common target goal. Then we have differentiated reinforcement, so it works as lowest. In here, positive reinforcement is used to target one behavior while another targeted behavior is being reduced or eliminated. The A-level system systematically incorporated shaping new behaviors with differential reinforcement and consequences, with the ultimate goal of generalizing new skills to the classroom and home environments. Then we have timeout, so basically we place the child to the side, restricting participation in music and prompting to watch the other children so that they understand the behavior that is expected. Then aversive stimuli result in pain or discomfort and are not recommended or permitted. Then we have overcorrection, so it teaches clients correct alternative behaviors in lieu of inappropriate behaviors. So we have restitutional overcorrection, so it requires a client who has disturbed an environment to return the setting to its improved state. And then positive practice overcorrection, so the client here is required to demonstrate appropriate behavior in an exaggerated manner or overly correct practice or for an extended period or number of times. And then negative practice overcorrection, so it requires them to perform the inappropriate or undesirable behavior until satiation occurs or fatigue. As behavioral approach progresses, we now have cognitive behavioral therapy. In CBT, we have three domains: cognitive, behavioral, and physiological. Cognitive, we have cognitive restructuring, such as thought stopping or cognitive reframing. And then behavioral, exposure, response psychoeducation, modeling, self-monitoring, role-playing, anger management, and behavioral activation. And then physiological is the biofeedback and relaxation. So it is used progressive relaxation. It is used in the field of medicine, preceded by music listening and followed by imagery for focus of attention away from the medical procedure. And then cognitive restructuring. They alter the cognitive distortions that cause the clients to perceive themselves negatively. And then cognitive reframing, changing how they see or changing their perspective. It is more effective and usually used with music. And then assertiveness and anger management, they use improvisational drumming effective. Now we have behavioral techniques used by music therapists. First is the object of behaviorism. It is used to identify, modify, count, or observe a behavior or behavioral indicator of a cognitive or affective process. Next is observation are documented. Occurring events and their magnitude must be done before implementing any behavioral program. Then introduce contingencies into the environment to influence the client into modifying his or her behavior in a positive direction. So purposefully selected contingencies must be established for a period of time if a new behavioral pattern is to be established. And lastly, evaluate results through continued or post-observation of the targeted behavior. Okay, so that's a lot of information. So I'm going to be cutting the video into 2 parts. So we end with the first 2 sections, and then I will discuss more on the last section of the approaches, and then introducing the methods and materials, and of course the improvisation. So hope you stay tuned and enjoy.